Hi, it's Dr. Handleman with Advanced Regenerative Orthopedics in San Rafael, California. I'd like to explain a little bit about what I do and how it is different from much of what goes on in orthopedic medicine. I talk to many, many patients, and they become very frustrated with the standard medical system, the standard traditional approach to orthopedic problems. Many of us know what that is, which includes cortisone injections, anti-inflammatory medications, and then the possibility of surgery. I do regenerative orthopedics. Regenerative orthopedics is something very different. The concept here is that the body has a natural ability to heal itself, and by the use of the body's own natural healing substances, that we can kickstart that healing. We can stimulate repair, and we can do this non-surgically in a way that's natural. So let's take knees, for example. The traditional approach, the patient sees a specialist for knee pain, let's say, and they may get an x-ray, they receive a cortisone injection. Maybe they get some temporary improvement, but the pain typically comes back. They may be sent for physical therapy. They do their best to strengthen the area, but often the pain continues. Then they get sent to the orthopedic surgeon, and then we know the rest. They may be scheduled for an orthopedic surgery, an arthroscopy, or a knee replacement. When someone comes to see me, I have an entirely different mindset and approach to this patient. I do a full evaluation of that body part as well as related areas. For example, if I'm seeing someone with a knee problem, I may evaluate the rest of their leg and their lumbar spine and their hip, etc. Because we know the body is connected. We want to put those pieces together, make sure we don't miss anything. Once I do this, I perform a physical examination, ultrasound examination, and come up with the most specific idea of what is going on with this patient, what is causing the pain. It's often more than one thing. It's not just what we might see on an x-ray, but it can be a combination of factors that involve multiple body areas. From there, I come up with a treatment program. Our treatment is regenerative, so it involves the use of the body's own regenerative healing substances. And these involve the concentrated platelets that we derive from the blood. This is called PRP, and that stands for platelet-rich plasma. The platelets in the blood contain growth factors that stimulate repair and are part of the overall repair process. Additionally, in some cases, I utilize a stem cell or a cell-based preparation. These cells are derived from the patient's own bone marrow. So with a minimally invasive technique, I extract bone marrow from the back of the patient's hip. From there, we process that marrow in our laboratory on site, and we derive a concentrated cell solution that contains patient stem cells. These are combined with the concentrated platelets, or PRP, for our stem cell procedures. Now, patients may ask, what is the difference and why would I need a stem cell procedure versus a PRP or plasma procedure? Generally speaking, PRP is useful in milder conditions involving joints or arthritis, in tendinitis, in situations where the patient may have pain, the body's under stress, but there's not significant structural damage yet. In that case, the PRP on its own is fantastic and can give us a lot of improvement in terms of pain and reverse that degenerative process. If the patient has more significant structural damage, such as moderate to severe arthritis, tears in tendons, ligament tears, generally more structural damage, they are more likely to be a candidate for a cell-based procedure that has a more robust healing property, longer lasting healing process, and more likely to repair that kind of structural damage. So when a patient comes to me, my goal is to determine what is the best procedure for them. That doesn't mean what is the best procedure for me. It means what is the best procedure, give them the best result with as little downtime and intervention as possible. In some cases, I may even refer the patient out to have a surgical procedure if I believe that is in their best interest. However, I would say at least 80 to 90% of my patients I can treat here, and they, in my opinion, they don't require surgery. So once I've determined what the best recommended treatment program is for this patient, they can make their decision and give them all the information they need in terms of what the procedure involves, what are the potential side effects, which in general are very, very low, what the rehabilitation may look like, how long it will take them to get better, etc. When they come in for the treatment, then they know what to expect and we can move forward. The treatment itself, these are injection-based procedures. They're not surgery. They're minimally invasive. Most of them are done under local anesthetic and are very well tolerated. This is not surgical. The downtime is usually limited, and people bounce back and can resume most of their pre-injury activities pretty quickly within a few weeks. Only the more vigorous and higher impact activities sometimes take a bit longer than that. Overall, these are very effective procedures. We have good data, which is registry data that Regenexx has on their website for different joints that can inform the patient as to what's the average improvement that they can be expected to have for this procedure. That's very good data. It's there for everybody to see as public information. Now, this is essentially what I do here. This is fantastic treatment. This is state of the art. I'm using the patient's own cells. These are live cells. These are not placental products. They're not embryonic cells. They're not birth cells or cord blood. These are derived from the patient's own body. They're viable and they're live. This is the best autologous, meaning from the same patient back into themselves, the best autologous regenerative treatment that is available. I've been doing this for 10 years with Regenexx. I've treated thousands of patients with excellent results. I'm happy to see you for a consultation, go through this process and see what I can do for you, because it's very likely I can help you. I love saving patients from the surgeon's knife, get them better, get them back where they want to be non-surgically without complications. So again, Dr. Handleman, it's Advanced Regenerative Orthopedics in San Rafael, California. I really appreciate your listening today, and give us a call. We'll get you set up. Thank you.